Please be seated. I am Councillor Duncan Anderson, Chair of Council. I'd like to wish you all a happy new year and welcome you to the first full Council meeting of 2024. We're not expecting a fire practice, but in the event of hearing the fire alarm, please leave the chamber and turn right to proceed down the stairway through the emergency exit on the ground floor. Assembly point is in the public square in front of CAS beyond the fountain. Anybody with mobility issues should wait at the refuge area near the lift and use the intercom button to call for assistance. This meeting will be recorded and published on the Council's YouTube channel. By entering the Council chamber, you're agreeing that you'll be recorded and your image will be retained and broadcast by the Council. Any members of the public or press are intending to record or film any part of today's meeting, please ensure that this does not disrupt proceedings. Can everyone ensure their mobile phones are switched to silent mode, please? I've received apologies for absence from Councillors Linda Curran, Richard Allen Jones and Andy Pickering. Do we have any addition or apologies? Councillor Nevitt.
Councillor Andrew Robinson.
Thank you. Councillor Robinson. Any further apologies? Councillor Shaw? Councillor Laney May Ball. Councillor Susan Durant. Any more? Those will be recorded in the minutes. Item 2 is to consider if the public and press are to be excluded. There are no exempt items on today's agenda. Item 3 is declarations of interest. Does anybody have a disclosable pecuniary interest or other declaration related to the business of today's agenda? If so, please declare now and complete a declaration form, Government's Office. No. Okay, then we're on to item 4, minutes of the council meeting held 16th of November 2023. Are the minutes a true and correct record? Have them moved? Can they be seconded? Seconded. All in favour? That's an agreement. Item 5 then. Announcements. I will do a quick one. The cafe downstairs vibe has reopened and I hope you'll all make some use out of it so it can stay open. I understand Mayor of Doncaster, Ros Jones, has an announcement.
Thank you, Chair. And my announcement is an update to councillors on South Yorkshire Airport City. I would like to provide a brief update on our South Yorkshire Airport City programme. I can tell the council that we are still progressing positively and I remain hopeful that we will secure the airport this year. The procurement exercise to find an appropriate operator is ongoing and this will continue as planned, with the aim of having an airport operator appointed in the spring. I remain hopeful that we can agree to and sign a lease with the airport landowners. As a council, we are actively working to achieve this, and when I can share more, then I will. Members will be aware that this council is asking South Yorkshire Mayoral Combined Authority for funding support through an outline business case that is being considered next month. Once this gains support, then a more detailed business case will be put forward. It does, however, provide another positive step in our ambition to reopen Doncaster Sheffield Airport. As I'm sure members can imagine, this is a complex and detailed piece of work, and quite rightly, we are ensuring it is done in the correct manner, and this takes time. I ask for patience from our councillors, members of the public, and our business community. Saving and reopening our airport, as I've said many times, is my #1 priority, and we are following our carefully managed plan to give us the greatest chance of success. Thank you. I've got a further small announcement, Chair, if I may. And that is, I would like to congratulate and welcome Ken Guest as a Labour councillor for the City of Doncaster. Ken is a dedicated community champion within the ward and fought an honest and positive campaign and actually increased the Labour vote sharing, winning with over 56% of the votes. I'm sure you will be a brilliant advocate for Rosington and Bawtry alongside your fellow ward councillors, Ken. I would also like to welcome Bev Chapman as our newest Labour councillor. Bev, you are the dedicated councillor for your ward of Mexborough, and it is a pleasure to have you join the Labour community. We have secured significant regeneration funds for Mexborough and it will lead to an incredible transformation over the next few years. Welcome. Thank you, Chair.
Thank you, Mayor Jones. I understand that the Deputy Mayor doesn't have any announcements. I understand that Joe Blackham from Cabinet has an announcement.
Thank you, Chair. It's an announcement re the motion passed at full council in September. At the meeting of full council in September last year, a motion was passed relating to the investigation, the implementation of a road traffic order, environmental weight limit restriction order on the A635 between Hittleton and Scoresby. I would like to inform council that the outcome of the following initial consultation with statutory consultees, South Yorkshire Police, Road Haulage Association and National Highways, they are not prepared as statutory consultees to support the measures proposed. However, there has been the recent government announcement of Network North in October, where they reallocated funding from the cancellation of Phase 2 of HS2. As this is the only named scheme within this fund, I would expect this puts us in a good position for this new government funding. This council and the communities of Hittleton and Mar have understandably been seeking a bypass for their communities to resolve the ongoing traffic impact problems for many years, and it was feared not to be forthcoming. However, we now have the opportunity to bid for the funds required to finance the bypass. On this basis of the government announcement and the lack of support from statutory consultees in relation to a potential TRO, it is vital that City of Doncaster Council put every effort into pursuing this vital opportunity to deliver the bypass, and therefore propose to stop any work on investigating a potential TRO environmental weight limit restriction order. I must emphasise that if we were to continue down the route of exploring a TRO, then this would be detrimental to our case for a bypass. We have already been in dialogue with both the Department of Transport and Transport for the North to undertake work in preparation for the positive opportunity of government fully funding the A1, A19 Hittleton bypass. I will keep council informed of progress over the coming months. Thank you, Chair.
Thank you, Councillor Blackham. Do any other members of Cabinet have announcements they wish to make? No. Damien, do you have an announcement to make?
None.
Thank you, Damien. Item 6 is questions from the public. We have no questions from members of the public. Item 7, result of the Rosington and Bawtry by-election held on the 16th of November 2023. The purpose of this report is to note the results of the Rosington and Bawtry by-election held on the 16th of November 2023. There were 4 candidates standing in the by-election, with the Labour candidate, Councillor Ken Guest, duly elected from a turnout of 19.2% of the eligible electorate, with 1,984 votes cast out of 3,585 issued. The full breakdown can be seen in the report. On behalf of the Council, I would like to congratulate Councillor Guest, welcome him to his first Council meeting and wish him every success in his role as an elected member. Does any member wish to speak on this item? I've got Councillor Bob Anderson.
Yeah, I'd just like to say a few words if I can, Chair. I would just like to say a massive well done to Ken Guest. He was a great candidate and now already showing what a fantastic ward councillor he will be. I've known Ken for a number of years and I've seen firsthand the fantastic work he does in the community on a daily basis. I have to say our campaign was just how I think a local election campaign should be run. A good, honest one where you don't have to talk about who's standing against you, but instead just promote what you can and will bring to the table if elected. And if you are active and hard-working in the community like Ken is, that is, in my opinion, is what voters want to see and hear. Ken is from Rosington, so all the great work he has done over the years has been in that part of the ward. But I have to say, since being elected a couple of months ago, he has been so active and visible in both Bawtry and Austerfield, and the whole ward is seeing what a hard-working councillor he is. I have total respect for all the candidates who took part in the by-election, but without doubt the best candidate was elected. And that's not just my opinion. the result shows that electorate thought that as well. So a massive well done, Ken. We're already showing what a great team you, Rachel, and myself are. I'm looking forward to the coming months. We have a busy diary, but we wouldn't want it any other way. So well done, Ken. Once again, well deserved.
Thank you, Councillor Anderson. Do we have any other members wishing to speak on this item? Councillor Guest.
I'd just like to thank everybody that took part in my campaign, that turned out on what was a very wet and windy late October and November. Thank everybody that assisted me through that. I'd like to thank the electoral services and everybody that did the count and all the staff involved with that for running a very thorough campaign selection service. I look forward to serving Rosington and Bawtry and Ostfield over the coming year and a half. And I'd finally like to thank Bob and Rachel for their support throughout, in particularly Bob, who's been mentoring me for the last two or 3 weeks. So thank you, everybody.
Thank you and welcome, Councillor Guest. Can I ask the members move that the results of the by-election be noted? All agreed? That is noted. That takes us on to item 8, Local Government and Housing Act 1989, 6-month review of the allocation of seats on committees and subcommittees appointments to outside bodies. The purpose of this report is to inform the Council on the mid-year review of the allocation of seats on committees, subcommittees and outside bodies. There are a number of changes as outlined within the report to committees and subcommittees following some recent changes in the political makeup of the Council and the by-election held in Rosington and Bawtry. I believe there is still one appointment from the Labour Group outstanding to the Chief Officer's Appeals Committee. Deputy Mayor Councillor Jones, do you wish to speak on this item?
Yes, thank you, Chair. Yes, we have consulted with our colleagues within the Labour Group, and I'm glad to say that Councillor Ian Pearson has come forward to fill this vacancy. Thank you, Chair.
Thank you, Deputy Mayor. Do members agree to the recommendation in the report and to the proposal by Councillor Glyn Jones that Councillor Ian Pearson be appointed to the Chief Officer's Appeals Committee? It's all agreed. Thank you very much. Item 9 then is the 2023 Director of Public Health Annual Report for Doncaster. I would like to welcome to the meeting Rachel Leslie, Acting Director of Public Health, to introduce this item. I'm also delighted to see Dr. Rupert Suckling back in the chamber, and you will notice that after we have considered the annual report, there will be an opportunity during the next agenda item for members to formally record their thanks to Dr. Rupert Suckling for his distinguished service to the Council and the wider city. Rachel, would you like to introduce the report?
Thank you, Chair, and good afternoon. Thank you for the opportunity to present the 2023 Director of Public Health Annual Report. Directors of Public Health in England have got a statutory duty to produce an independent annual report on the state of the health of their communities. We chose to focus on children and young people at the start of 2023. We chose to focus on this for a number of reasons. We knew and we heard how the COVID pandemic and things like lockdown had affected children, young people and their families. We also commencing a Fairness and Wellbeing Commission process, which we hoped would look and focus on children and young people as well. We also wanted to revisit some of the work that was done pre-pandemic and before public health teams were drawn into pandemic response and to reflect back on some of the progress that we'd made and some of the priorities set before. So we started a process at the start of 2023, agreed with Rupert to have a DPH annual report which focused on children and young people. The report includes data. You'll be familiar with seeing data tables in DPH annual reports and provides that commentary that you've seen before, including the overall state of health of the whole population. We've also provided some pages and some statistics and information on how healthy children in Doncaster are. We also wanted to focus on inequalities and health inequalities as well, as Rupert's described before, the other 80%. And how we impact both social factors and physical environment and the link that that has with positive health and wellbeing outcomes. There's many familiar elements in this year's DPH annual report that you'd have seen in previous years as well, and one is a table to describe the use of the public health grant. Those that have used the printed out version of the report that was sent out previously might have noticed that there were some errors in the figures for this year's budget allocation. If you use the link that's provided in your report that accompanies the DPH annual report, the correct numbers are contained in there. We had a bit of a formatting issue when we moved it over. We will ensure that for the records the correct data was there. I'm hoping you'll all be relieved and assured that we haven't made any radical changes in the funding of most of our services, including our mandated services. And please do use that link to look at the correct data for how we've used and set our grant for this year. Focusing on children and young people, the report presents a number of strengths and achievements of the team and the wider council and Team Doncaster partners over the previous year and before. You'll see in there a summary of a capabilities report that was produced and worked with the University of Sheffield pre-pandemic. That was a report completed in 2019 and worked with young people themselves to describe and understand what they needed to live their best lives. We've used that in the report, revisited it, and looked at developing a framework that services can use to really maximise some of the positives and some of the protective factors in young people's health and well-being. The report also looks in a couple of areas. So it summarises the work of the Fairness and Wellbeing Commission over the last year for children and young people. You can also see an update on the HDRC, the Health Determinants Research Collaboration, and the Baby D, the Born and Bred in Doncaster project. That recaps on the project itself and provides a year update from its instigation last year. We've also included a series of achievements across the public health team as well. For us, 2023 was our first normal year since the pandemic, and it meant for us a lot of going back to what was important before and being able to focus on some of our key commissioning areas. The report itself also describes 2 focus areas, so it includes how we use intelligence and local insight. It includes information about the pupil lifestyle survey that we use in schools, how our school nursing service has used and developed school health profiles with schools, and how we have young apprentices working in and with communities as well, and using that as a lever and opportunity for insight and voice. We've also described how we've used additional fixed-term funding that's been allocated nationally. In there, you'll see how the Supplemental Substance Misuse Grant has been used, or how it will be used to achieve that generational shift in demand for illicit substances. We've also described how the public health team have worked with colleagues as well in the fixed term funding for family hubs. Really important investment there around attachment, breastfeeding and parental well-being. Finally, the report includes a summary and a selection of final thoughts. In the summary, we include some of the findings from the Fairness and Wellbeing Commission and that desired future state that we have for children, young people and their families in Doncaster. Our final thoughts include how important we feel the voice and experience of children and young people is and has been in the shaping and design of services and in the shaping of local policy. We've described as well the importance of compassionate, prevention-focused approaches, particularly those that help create the social conditions for better health and well-being, and how we can use that compassionate approach to reduce health stigma, particularly around mental health and well-being. Finally, final thought and reflection around equality and inclusion health. You'll see through the report as well, it's described some of the additional barriers that some Doncaster children and families face in trying to access the services and achieve the same aspirations that some of their fellow pupils will have. We need to put a lens through our services and through the way that we work and understand how those additional challenges and additional barriers and how we might need to work differently. Finally, I just want to summarise through that summary and through the final thoughts. I hope you can see within there a selection of approaches we'd like to take to create fairer communities for children, young people and families in Doncaster to help them live, grow, learn and play. Thank you, Chair.
Thank you, Rachel. Councillor Nigel Ball is the portfolio holder for Public Health, Communities, Leisure and Culture. I understand you wish to propose this report for approval by Councillor. Councillor.
Thank you, Chair. Yes, I do. Well, first and foremost, I'd like to thank our public health team for all the work they do on a day-to-day basis, every single day in their efforts to make Doncaster citizens healthier, happier and able to live, hopefully, longer, illness-free lives. I commend this report to full council as it demonstrates that despite a national backdrop of continued decline set against life expectancy rates, our public health team in Doncaster are doing their best for the residents of this city. However, it's worth noting that our public health team can only do so much to support, encourage and actively promote healthier living under the current punitive funding regime that impacts on the lives of our people who live and work in our most deprived communities. The current picture in Doncaster, despite local initiatives and interventions, is hampered at national level, and we have seen the healthy life expectancy of our people go into reverse and decline over the last decade. The Doncaster position is mirrored at a national level, and we have also seen over the last 14 years homelessness increase in our streets by 250%, child poverty at its highest level since 2010, with 18 million kids across Britain now living in low-income households. Food bank usage by over 400% increases. NHS waiting lists which are currently running at 400,000, whereas back in 2010 they stood at 100,000. Patients spending more than 4 hours in A&E is up 50% since 2010. 85% of cancer patients are waiting more than 62 days for treatment, when back in 2010 it was only 10%. And in November 2023, the UN, the United Nations, stated that poverty levels in the UK are simply not acceptable and that the government is violating international law. The inspector urged ministers to increase welfare and health spending. The current government on its own website promotes and accepts the argument on wider determinants of health, and these being the primary impact on a person's life and life expectancy, and that wider socio-economic factors such as income, housing, access to healthcare, and these services play a massive role in a person's health and longevity. It accepts this fact, that it's not just down to lifestyle choices, certainly around the individual. Unfortunately, there appears little commitment to tackling these issues from our current government, in not only in Doncaster but nationally, and there has not been, certainly for the last 14 years. Britain as it stands today is broken. Our public services are in decline, and all whilst this country has seen the rich getting richer and the poor are ignored by this government. What we're seeing is a systematic drip, 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 brick by brick, destruction of our social and civic society. On a day-to-day basis, our public health team try to address the impact of the lack of initiative and funding from the last 14 years of government on the lives of the people of Doncaster. And for this and the report, they should be commended. And I in turn welcome this report as being a realistic, although in many places concerning report in terms of the state of public health in Doncaster. Thank you, Chair.
Thank you, Councillor Ball. I understand Councillor Glennie-Smith is seconding the motion.
Would like to formally second the motion, and I would also want to thank our public health staff for the work that they do across Doncaster. And Rachel, I'm particularly grateful that you quoted the words at the beginning of one of my heroes, Sir Michael Marmot, who has never blamed the community about their ill health. I haven't felt as concerned in absolute truth about our NHS and public services as I do now. I started work in the NHS in 1972 and retired in 2022. I feel that was an absolute privilege. But the service and our public services are currently on the knees. And would anyone wish to deny this, I would ask that you spend several hours in our accident and emergency department or are waiting for surgery. This is in no way a criticism of our amazing NHS and public service staff. Sorry, I've just lost my place. And neither, because I can almost hear it being said, is it the fault of our doctors, as it clearly isn't. And it should firmly be laid at the feet of our government for the last 14 years. And what we clearly need is a change of government. So I'm more than happy to formally second and accept this report.
Thank you, Councillor Smith. Do other members wish to speak on this item? If you could. I will take you in groups of 3 and then allow the Acting Director of Public Health to respond. I'll start with Councillor Ian Pearson.
Thank you, Chair. I too think it's an absolutely wonderful report, but I'm very saddened by the implications within the report of the decrease in life expectancy. And we can trace it all back to the cuts. I would say that I'm deeply saddened that this government cannot be bothered to deal with single vaping issues, the use of 10 centilitre vapors and nitrous oxide at this time, and don't take it to be an epidemic that is affecting all young people. I'm pleased that we noted it and are trying to do things, but unless this matter is helped at the national level, we're never going to stop people selling things that are not good for anybody, and particularly our young people. So can we please keep up the good work and push the government to take action? If not, they should step aside and let a Labour government get on with the job and help public health. Thank you.
Thank you, Councillor Pearson. I have Councillor Rachel Blake next.
Thank you very much, and I won't repeat what my colleagues have said, but share their sentiments in terms of the state of services and the reasons why. As Chair of the Health and Wellbeing Board, I totally support the report and would echo what Councillor Ball says in terms of, despite what we are having to deal with, not only our public health teams, but all our services involved in health and wellbeing constantly look to innovate, have a compassionate approach, and depend on the lived experience to direct the work that they do, which should be applauded. As a Cabinet Member for Children's, and speaking on behalf of myself and Lainey Ball, we recognise the focus on children and young people and welcome that, but also recognise that children and young people are everybody's business, not just one directorate. And I would urge everybody to look at the report and see what they need to do within their services about how they can ensure our children and young people in Doncaster have the lives that they should have in the future. It is fantastic that in Doncaster we haven't, despite what most other local authorities have had to do, get rid of our early intervention services, which should be applauded. We have the fantastic services that we have. We're there involved in the community. We're there supporting children, young people and their parents and wider support systems at the earliest opportunities, which is something that other local authorities haven't been able to do because of the budget pressures that they face, but we continue to invest in early intervention. And also would like to applaud our approach to involvement and engagement and really listening to the voice of children and young people. And we have a fantastic network of young advisors. We have fantastic children in care, council support systems, and we have other work like young advisors and young apprentices, such as from Stainforth, who attended our Health and Wellbeing Board recently and showed us how embedded young people are in our communities. So I applaud the report and will continue to work as the Chair of the Health and Wellbeing Board and lead member for Children's to make sure that we make the difference that is desperately needed in Doncaster. Thank you.
Thank you, Councillor Blake. Can I remind members, if you wish to indicate to speak, press your red button once and only once. If you press it again, it removes you from the list to speak. I've got Councillor Smith wishing to speak. Sarah Smith wishing to speak.
Me? Yeah, you.
Sorry, I didn't hear you there, Chair. I just wanted to really emphasise how important this report is, and I'm so happy to say that we've focused on children and young people for this report. Working with children and young people myself over the past 7 or 8 years, it's quite you see the stark difference that cuts and austerity have on young people, and then there was a significant difference over COVID. So really commend that. And as I've said before in this forum, you know, I represent a ward that has one of the lowest life expectancies, and it is the lowest for women in Doncaster. I attended the Fairness and Wellbeing Commission sessions a few times, which really, a lot of that kind of is in, that data is in this report. And I really wanted to commend how the young people were really involved in there. There were young people there, they had done this huge survey, real engagement. There was some really rich, critical discussions there. And I really think it brings this report and some of the somber statistics and what people are actually living with. It's the stories, not just data, but how it is affecting young people and other residents in Doncaster. But if you can get to look at some of the fairness and wellbeing data as well, I would really recommend that. And I just wanted to say just how much how important this is and what an important investment public health is into all of our lives, and how we need more support, grant funding from the government to continue to deliver better life outcomes. And I just wanted to commend us continuing work using innovative methods to get the lived experience voice in all of our reports and understanding what it is to live in Doncaster. Thank you.
Councillor Smith. I'll now allow Rachel to respond to those 3 comments.
So I'll thank Councillor Smith and Councillor Blake for their positive comments on the report. And we'll pick up, Councillor Pearson, your question or your point around vapes and vaping. There's recently been a national consultation that's closed around vaping, and particularly youth vaping, that seek to get opinions on changing the marketing, packaging of vapes to children and young people. Vaping has a potential role to play in harm reduction and stopping people from smoking, but should never be a recommendation that somebody starts smoking or starts to use vapes. Vaping itself and broader tobacco control measures, with smoking still being being the biggest factor in impacts on health conditions and life expectancy, should still be one of our most important focuses. We do have a tobacco control group in Doncaster that looks at both smoking cessation and vaping, and we are looking forward to receiving additional funds next year and for the following 5 years that we'll be using with our communities in novel ways to get them into our existing well-resourced stop smoking services. Just in the response to vaping, we responded as a council and we also supported our local schools to respond as well. Thank you, Chair.
Thank you, Rachel. I have Jane Kidd next. Councillor Kidd.
I was just thinking about this when people were speaking about the effect of poverty has on ill health. And I know that, you know, there are many sort of healthy eating courses, lots of advice out there. Everybody knows about the 5 a day. You compare the price of a bag of fruit and vegetables, say, with buying a packet of biscuits. What are you going to buy if you're on an extremely tight budget? Fruit and vegetables now are an extortionate price that are just a luxury for so many people. And this lack of good nutrition gets passed on to the next generation very directly. Pregnant women need a wide range of vitamins, micronutrients, and one of the obvious ones is if they're lacking those green vegetables, their children, their babies are at risk of spina bifida. So I just wanted to say, you know, I really commend people who run these courses, who give this advice. We can do it till we're blue in the face, but if somebody can't afford the healthy food, it's an uphill struggle all the way. Thank you.
Thank you, Councillor Kidd. I have Councillor Dave Shaw next.
Thank you. I also commend the report. It's my 10th report. I've sat in this chamber for 10 years now, and it's extremely sad to hear the constant downward trajectory that the health of people in Doncaster suffer. And it's through no fault of public health, who are asked every year to do more and more for less and less, as we see our residents become impoverished through austerity and other government measures. Every year this is presented, I do ask of public health that they involve themselves in a greater way in working alongside planning, because unfortunately we still see HIMOs push through the planning process with less than spatial standards than we have specified in our local plan. The government think that 6.5 square metres is sufficient space for someone to live their lives, and we have numerous landlords who are willing to exploit this and exploit people who have no choice but to live in such accommodation. We have, however, in our local plan, provision for that to be a minimum of 10 square metres. Still a paltry amount when you consider that the RSPCA consider a dog of 25 kilograms should have a space of 8.5 square metres, and a prison cell, although prisoners deserve no less humane treatment, of 5.8 square metres. So it would be a request. I obviously support the report and recommend it for its approval, but I would ask that Public Health make extra efforts this year to engage with the planning process and object to any HIMO that is being pushed through that has rooms that has less than 10 square metres. Thank you.
Thank you, Councillor Shaw. I have Councillor David Nevitt next.
Thank you, Chair. This report shows on page 43 and 44 that there is need for huge improvement and investment to get the major gains back to where we were 10 years ago or more. These are needed to assist the services. It states in red, amber and green, and the numbers are clearly shown, that progress is needed by authorities to assist the community. I commend the report. Thank you.
Thank you, Councillor Nevitt. Rachel, would you like to respond to those questions?
Yeah, thank you. So I'll start with Councillor Kidd there and the points that were made around healthy eating, particularly with pregnant women as well. So healthy weight, as I've described to many of you before, is a really complex contributors to healthy weight. I just want to pick up your part around pregnant women as well. So Healthy Start vitamins are available to all pregnant women and through to the first year of the baby's age as well. Also vitamins available for babies. Commissioned Health Visiting Service do promote and support the supply of Healthy Start vitamins as well, and vouchers for fruit and vegetables as well. We could probably do better with getting better uptake on that, and it's just one of the things that we would like that helps to improve the diet of pregnant women. Picking up Councillor Shaw's question around public health involvement in planning, we do have a dedicated wider determinants team that have got a good relationship with the planning team in the council and others. They've got several achievements to report on the last year, including around boilers on prescription, the uptake around that as well, with a published report around that. I understand your question around HIMOs, and I'll have a look at that separately too. Thank you.
Thank you, Rachel. I have Councillor Leanne Hempsall wishing to speak next.
Yes, thank you, Chair. I'd also like to thank our fantastic public health team. I've got a question for Rachel. After 14 years of austerity and all the cuts to services, has this impacted on the well-being of our communities and the people of Doncaster?
Thank you, Councillor Hempsall, and I have Councillor Phil Cole.
I just wanted to commend the report. I think it's excellent, and I think there's some very poignant and telling statistics in it. I just wanted to mention the 1840s for a second, because if you were born in Doncaster in the 1840s, you would live about 40 years. Women, I think, lived 42 years and men 40. And in the 150 years since then, life expectancy's doubled. But if you look at what's happened since 2010, the rate of improvement in life expectancy has slowed dramatically. In the King's Fund, the health charity said that between 2014 and 2018, it virtually flatlined. And between 2018 and 2019, life expectancy rose by just 0.3 of a year for men and 0.4 of a year for women. Whatever the government has done, whether it's austerity, whether it's ineffective health programmes, whether it's a failure to tackle the root causes of poverty, they have undermined that steady improvement in public health that happened over the previous 100 years. They've been incredibly ineffective. No one should thank them for any of that. But I think public health is profoundly important. And I would say that the work we do on smoking is absolutely phenomenal. The gender gap that used to be just a couple of years dramatically widened by the 1970s because of working conditions and smoking rates among men led to tremendous shorter lifespans for men rather than women. And actually, work by largely Labour governments to improve working conditions and the public health measures on smoking have dramatically improved the lives of men relative to women since then. But I would just say that the work on smoking, I think, has to continue. I think it's vital. I would say the HPV vaccination rates that we achieve in Doncaster, which are better than the region, better than the rest of England, are a real credit to our team and all of their partners. That is a vaccination programme, first introduced under the Labour government, I should say, that actually has the potential to eradicate a major cause of death among women within a generation. It's going to be phenomenal. We'll look back in 20 years' time. It will be one of the most successful vaccination programmes ever introduced. And the one thing I would ask about, Chair, is that we have to work to improve the MMR vaccination take-up rates. I know you've mentioned that in the report and flagged that up quite rightly, because since COVID and the vaccination programmes, there's been an anti-vax popular sentiment, particularly on social media. A lot of parents, pregnant women, become nervous about vaccinations, and it's a real mistake. We are going to face a crisis among children in terms of measles and deaths and serious conditions from measles because of a fall-off in the rates of MMR vaccinations across the country. So I commend the work that our staff have done on that. I think this is an excellent report. I think we have always had great public health teams in Doncaster Council, including, not least, Dr Suckling, who I think has been a very impressive figure in the whole time I've been a councillor. So I'd just like to commend the staff. Thank you for the report.
Thank you, Councillor Cole. Councillor Glenn Bluff.
Thank you very much, Chair. No surprises that we've heard austerity mentioned. Thank you very much, Councillor Cole. 14 years of the Tory government. Thanks very much. You did mention that since 2010 there has been a change. There's been a massive change, and I noticed the numbers in here about suicide and about mental health. I was going to sit here and not press the button, not say anything. Can't do it. Fed up of it. Because the biggest change since 2010 is not about money. It's not about financing the NHS. It's all this crap that we get coming through the system that's confusing our kids in school. The wokeism, the education, this stuff about gender, it's confusing our children. We have children coming home. I've got residents who've got children coming home and they don't know what they are. They don't know if they're male, female, about what they're doing. I've had my own kids question it. It's not on. It's got to stop. This is the biggest impact. In generations to come, people won't be talking about austerity because they'll recognise that that was needed at this time. What they'll be talking about is the wokeism, the gender politics, this rubbish that's coming through on the left side of politics. It's got to stop. It is confusing our kids. It's confusing an entire generation. It's giving people anxiety. It's causing major mental problems throughout society. and it's got to stop. And you will see these levels increasing regarding suicide, regarding anxiety, regarding mental health, because we are feeding crap in terms of this stuff to our kids in education, and it's confusing them. And you're on about what it was like before 2010. It was better when we didn't have these confusing messages coming through, so that children knew what a woman was, they knew what was going off, and it wasn't this
Councillor Bluff,
amount
can I
of
ask
rubbish.
you to pause for a moment while I take a point of order?
To moderate his language, please. Twice he's used an inappropriate word.
And they can try and defend it all they like, but the general public know that it's not on, and it's coming from their side. I've seen the international debates on this. They're trying to move gender dysphoria into being not a mental illness. They're trying to move it away from that. It's coming from their side, from their funding channels, and it has to stop because it's confusing our kids and it's going through the schools. And I do commend this report, but I think it's a very sad state of affairs that that's what's happened, and that's the biggest change since 2010, not about the funding.
Rachel, would you like to respond to those three sets of comments?
I will, and I'll start with Councillor Hemshaw's question first. The report does say that we all know when we feel healthy, when we feel well, when we've got a good sense of well-being. Yes, resources and funding resources to help people is part of that. But we've seen as well through our work with communities and the work that, well, Doncaster, I know other teams do as well, about how we support across and within communities helps to generate that general sense of well-being and belonging. So yes, services funding is important, but there's lots of other important elements to that as well. And I would like to think that despite having a fixed amount of public health ring-fenced grant for a number of years, we've been able to flex and grow our responsive working with and for communities too. On Councillor Cole's point, we'll thank him for highlighting vaccination. For public health-wise is one of the most effective measures for public health. HPV vaccination, you mentioned, human papillomavirus vaccination. HPV is the cause of almost every case of cervical cancer. The introduction of that, I remember at the very start of my public health career, 15 years ago was the introduction of that for girls initially, and is now available for boys as well. So as well as hopefully eradicating cervical cancer, will have an impact on oral cancers as well. MMR vaccination, measles, mumps and rubella vaccination, agreeing many of you will remember some of the impact that it's had on the uptake of that. When looking at vaccination, we like to look at our population as a spectrum. You will always have a group of people that firmly don't believe in vaccination. There'll be a group of people that go along routinely for all their vaccinations. Our work is with that group in the middle, which will probably need a trusted conversation with a healthcare professional to feel more confident. We certainly saw that in the COVID vaccinations. We had to go out and work with our communities and just give them that level of assurance around the vaccination itself. We've also found as well in evidence that actually, particularly for children, lives get really busy, and you might have had one or two reminders to take your child along for a routine vaccination. You've just not got around to it. So the intention's there, but will be really important to us. There are outbreaks of measles currently in London and in the West Midlands. We recently, just before Christmas, did a measles exercise, and that increase in the uptake of measles vaccination has come out as really important. Anyone in this room that's not sure that they've had their full coverage of measles vaccination, it's not too late. So please go along and check your records and take that up. On Councillor Bluff's queries, I would like to say that through our Fairness and Wellbeing Commission process and through various other lots of conversations that we've had with children and young people, through that we've understood the things that do have an impact on people, on young people's health and well-being. You mentioned suicides as well. We review every single suicide that happens in Doncaster, and we look at the root causes and things that can be different. And I would say that although the risk of suicide in people that are from an LGBTQ plus background is higher, much higher, I wouldn't say that the elements that you've described are a causal factor within that. Thank you.
Thank you, Rachel. I've got Councillor Holbrook next. Just a reminder to everyone, you can only speak once on each agenda item. I know some people are trying to come back in.
First of all, I'd like to commend the public health report. It's quite clear that the work that's been carried out, across the number of years, is starting to take dividend. One of the things I'd like to sort of mention is that there are various issues and key issues that are facing the children of Doncaster. And I'll just take the points that obviously Councillor Bluff has imparted. Could you just kind of relay what are the most important points that are facing the children of Doncaster at this time? Thank you.
Thank you, Councillor Holbrook. I've got Councillor Cynthia Ransom.
Thank you, Chair. I've listened to what everyone said, and of course you've all missed the elephant in the room. And the elephant, of course, in the room is obesity. And since 2010, obesity in Doncaster has gone through the roof. However, fast food outlets have also gone through the roof, and guess what? They're all in deprived areas. So I take on board what he said about fresh vegetables, but also looking at the fast food. People live on fast food. Children obesity is hugely on the increase. DRI is packed out with people with sort of needing knee operations, hip operations. It's weight related, and it is also the situation of less exercise. And what has that got to do with money? Because we in Doncaster have spent a lot of money on this, cycle lanes, everything. So what do? You take the horse to the water, but can you make it drink? But fast food doesn't go well with me alongside food banks and obesity.
Councillor James Church.
In terms of woke, and I've never really understood it, but in terms of woke, can anybody explain to me what part woke played in life expectancy being stalled, what part woke played in 7.5 million people waiting for hospital appointments, and the re-emergence of Victorian diseases? What part did woke play in that?
Rachel, would you like to respond to those?
I will say thank you. I'll start with Councillor Holbrook. Just checking I understand your question. You've asked me what the important things are, what the most important things are to children and young people around health and wellbeing. So I could give you my verdict on that based on the data that's presented in the report and what we heard through the Fairness and Wellbeing Commission. I would encourage you to look back over that as well and draw your own. I would say one of the most compelling stories that we heard at one of the Children and Young People's focus sessions at the Fairness and Wellbeing Commission was around the inclusive education. So we heard both stories from young people about their education experience, and we heard them recount stories from their friends and their peer group as well. It really demonstrated to me how schools that are really part of their communities, that take that holistic approach to working with their children and young people and consider their broader as well as their educational needs, made a real difference in their lives. So that would be one that I would pick out from that process. Others might draw different conclusions from that. Councillor Ranson, your question around obesity, I described earlier about excess weight, obesity and underweight being a real complex issue with lots of different drivers and lots of different elements to it. You'll see in the report as well, we've described a compassionate approach which recognises that it's not just people's choices and behaviours, it's a symptom or a result of the places and the opportunities that people have. I mentioned the wider determinants team. They do also work with licensing colleagues as well around fast food takeaways. We know that there's that link between proximity of hot food takeaways and schools. So it is a complex situation. I would encourage you looking into that compassionate approach because we do need to look more broadly than just a lifestyle choice. The final comment, I think I can comment on public health things. I don't think I can confidently comment on wokeness, unfortunately, but thank you, Chair.
Thank you, Rachel. Do we have anyone else wishing to speak on this item? Councillor Iris Beach.
Thank you, Chair.
on the subject of vaccinations, and I know it doesn't really for people in this chamber, but your parents, elderly parents, please make sure that they do get the available now shingles vaccination. I have seen how devastating it is to someone. You are very, very ill. So I would, make sure your nearest and dearest who are in the age bracket, because it's only quite a short bracket, I think about 10 years, they do get the vaccinations against it.
Thank you, Councillor Beach. Councillor Itunde Elibuwan.
Hi. First of all, I'd like to say thank you, like others. I just want to echo the appreciation for putting all of this together. I want to ask questions about the born and bred in Doncaster. My children are born and bred in Doncaster, and I love these initiatives. The first question I want to ask is, I can see here that the study started in 2022, and 1,000 people have signed up to it, thereabout. I just want to know what percentage of ladies this 1,000 represent. That's my first question. The second question is the inclusion factor in the study in terms of demographics, maybe age of participants, income background, ethnicity, so we could have a robust data. And also, lastly, I read here that it's done in collaboration with Doncaster Ambassador Law NHS Hospital with some stakeholders, key stakeholders. Will this be including GPs, health visitors, and so on? I just want to know how people would have access to this kind of information and if it's all collaborative. Thank you very much.
Thank you, Councillor Elibuwan. Councillor Nick Allen.
Thank you. I'd just like to point out that in 2010, the NHS budget was roughly about £105 billion. And it's now roughly about £182 billion. And there is no way you can claim, anybody can claim, even adjusted for inflation or any other comparison, that £182 billion is less than 105. We're spending more on healthcare now than ever before. There's no way or dispute that. I was intrigued by parts of Councillor Cole's history lesson regarding average life expectancy in Doncaster in 1840 versus now. You'll find that actually that type of demographic change has occurred across the globe in lots of nations, industrialised, not industrialised, and post-industrialised. There are lots of other reasons for that. And I was quite surprised that you neglected in your history lesson one significant impact on all our health is the fact that, obviously, as we know, the Labour government in 1945 brought in the NHS effectively, and you managed, more or less, to undermine it from the very start by, amongst other things, introducing prescription charges. Obviously, famously, Mr. Bevan resigned about it. And so the idea that you can sort of, remove yourself from any responsibility for this is frankly rather laughable, because you played your part in these type of budget matters too.
Rachel, would you like to respond to those comments?
Yeah, so first of all, Councillor Beach on the shingles vaccination, I'll thank you for doing our job for us on that one in promoting that. Let's see, the question around Baby D for Councillor Lebonwi, sorry. So I understand that as a research approach, all women had a chance to opt in or opt out of that. We can get in touch with you with some more information about that recruitment process and who's involved with that. And I think you've asked me about Fairness and Wellbeing Commission and who is involved with that as a process as well. Within the report, there's a link to the Fairness and Wellbeing Commission pages that includes a report on each section and the commissioners that were involved in that as well. You've asked specifically about the involvement of the hospital and with GPs as well. So yeah, we've had representatives from the health service to provide that voice, but also if you look through the Fairness and Wellbeing Commission pages and also the report that's on its way out soon as well, you'll see that mixed methods approach that we've used to get as broad representation in comments and experiences as possible, which has included a number of things. So I could perhaps follow up with you on those 2 points for that extra bit of information. Thank you, Chair.
Thank you, Rachel. Does anybody else wish to speak on this item? If it's a point of order, then yes.
Is this a political debate or is it questions for the officer? Because it seems that our opposition party want to have a political debate, which I'm sure we would all be happy to have. However, I thought the idea was that we asked questions of the officer. Can we just confirm what we're up to here?
It is questions and comments on the report. If members wish to draw political points from that, they're entitled to do so. I do feel that it's happened equally, at least on both sides. So unless my advisor tells me that I've got something wrong there, is that? Oh, I think we're within the bounds of allowed conduct there. Okay, nobody else has requested to speak. So as the proposer of... Yes, if you'd let me finish my sentence, Nidge. As the proposer of the motion to accept the report, Councillor Ball has the right of reply. Would you like to exercise that now?
Thank you very much for that, Chair. I think it's worth putting in context here that the statistics I used, none of these were made up on the spot, or they come from misinformation like we do get from a number of MPs, and some of them very local. They were actually made. They were actually there. They were researched, and I found these stats. So that one there, that's around the NHS waiting list, basically is from the NHS. Okay, and it clearly shows you there that there's an increase effectively from 2010 to 2020. So it's not just pandemic. It's sort of like more than that, and it clearly shows you basically that the increase has been from while the Conservatives have been in power. The second thing I need to show you as well on this is...
Can you please allow Councillor Ball to speak? As I have said, political comments are perfectly appropriate. This is a room full of politicians. The only one in the room who isn't allowed to be political is me, and I think we can all agree that I have refrained from being so. So, Councillor Ball, if you'd like to continue.
And the second one I want to show you is basically that increase also took place from 1990 to, roughly about 2000, again, under the Conservatives. This has a direct impact on people's lives and longevity. That's why it's relevant to that report that we've just had today from, obviously, our public health team. And again, just on terms of some of the other stats, in terms of cancer treatment and 62 days waiting for treatment after a GP referral, this is from the House of Commons Library. So it's not something I've just made up on the spot. It's actually been researched, and I've spent a bit of time pulling this together. I mean, I find people need to look at the holistic reasons why people are becoming unhealthy, and I do take some of the points that's been made on board by particularly opposition councillors in terms of sort of like obesity, for instance. I mean, I do take that on board, but I honestly think that our Deputy Director of Public Health has said that some of the reasons for that are much more complex than we could take on face value. And we know that a lot of people now are working probably 2 jobs, and effectively it's much easier to sort of like buy a really, really cheap takeaway and feed 4 kids and actually spend 3 hours cooking something. And the reason why they are working 2 jobs is they're trying to pay for a mortgage or rent, or they're having to deal with a cost of living crisis that suddenly appeared on the horizon over the last few years. So all these things have an impact on people's lives, and these are the wider determinants of health. They're not lifestyle choices to a large degree. They're caused by things that hover around the edges that make people do and take certain actions that are sometimes quite negative. So whilst I sympathise to some extent, I think it's much more complex where, the fact that, people are just eating too many takeaways and this, that and the other. We've seen these things also impact on people's lives, where we've seen, for instance, direct cuts to local government over the last 14 years of certainly 31% to Doncaster's budget. We've seen, and however way you try to cut it, Councillor Allen, we've seen also NHS cuts. In South Yorkshire, the NHS are facing a cut this year of up to 40 million. And that'll impact on frontline services, whether you like it or not. We've seen successive benefit cuts. That's a real cut on somebody's income, effectively, that's potentially more than likely living in a deprived area, that's not on a lot of money anyway, but certainly the government keeps going back and back and back and back and back again to hit the people that are the most vulnerable, people that are on benefits, people that are using sort of like disability benefits for a large degree. And we've seen that's what they do, rather than, if you like, putting something in place that, if you like, taxes that those have maybe got a bit more money and they can afford it, so we can have much more of a, I suppose, a sensible, civilised society. We've seen also, you know, the punitive bedroom tax in place as well. We've seen that take place. So all these things have these effects on people. So that's how, when we look at a public health report, we need to take these wider determinants, you know, on board. We know that some of our most deprived communities are ex-mining communities. And some of those jobs were lost in the 1980s. You know,
30 seconds remaining, Councillor Ball.
Yeah, we know that some of that is down to the fact that were basically sort of like due to, you know, government sort of like closures of mines. But effectively, that has had an impact, and it's had an intergenerational impact on people's lives. Lastly, very lastly, before I go, thank you, Chair, just indulge me for a second. In terms of wokery, I won't play your fake culture wars, because that's what it is. One of our local MPs does it. He does it very effectively. It's distractionary politics. And we know it's from the Lee Anderson school of politics. That's what it is. So when you talk about woke, what it means effectively is that you are politically aware. It originates from the civil rights movements in the 1950s and 60s.
That's your 5 minutes now, Councillor Ball.
You are socially and politically aware. Thank you, Chair.
Thank you. Councillor Allen. You've already spoken on this issue, and we have just had the right of reply. We can't have a reply to the reply, otherwise we'll be ping-ponging back and forward all day. The proposal that the 2023 Public Health Annual Report be noted and published has been proposed and seconded. Is it agreed? Agreed. That is agreed. Thank you. That takes us on to item 10, vote of thanks for Dr. Rupert Suckling. Can I invite Mayor Ros Jones to propose the vote of thanks to Dr. Rupert Suckling, Director of Public Health?
Thank you, Chair. I would like to propose a vote of thanks to our Director of Public Health, Dr. Rupert Suckling, on behalf of the people of Doncaster and, of course, all the members in this chamber for your years of service to this city. We are delighted to see you present today for the presentation of the 2023 Public Health Annual Report. Your commitment to this borough and its residents has been greatly appreciated and valued, especially with your expert guidance and leadership throughout the global COVID pandemic and its impact on the people of Doncaster during those very troubled and turbulent times of the COVID pandemic, when we were seeing hundreds of cases and many deaths. Your honest, politically impartial and heartfelt regular updates were welcomed by so many of our residents and the councillors. I personally would like to thank you for all your support you have given me, which has been greatly appreciated. Your calm and collective approach, alongside your great knowledge and outstanding leadership, will be greatly missed. I wish you all the best for yourself and the family in the future. Thank you, Rupert.
Can I invite Councillor Nigel Ball to second the vote of thanks?
Yeah, thank you, Chair. Rupert, I've done some words here, but honestly, it's not going to do you justice. It really isn't. I mean, it's really nice to see you here today with a really snappy haircut and you're wearing your signature gilet. And if you hadn't have turned up like that, I'd have been thinking, oh, but you have. And that honestly has made me feel a lot better. So thank you very much for that. I mean, while I've been portfolio holder, I think it's fair to say that Rupert has always been my go-to for support and answers. And he's the first person that you'd pick up a phone call or do a Teams meeting, or you'd sort of like meet in person to sort of like, you know, discuss things. And some of those things, I'm sure Rupert's aware, were pretty daft questions, but Rupert knew them, and he always knew the answers to them. And his answers were always balanced, and I'd be like hyper, but his answers were always balanced, well thought out, and pretty much bang on the nail every single time. So you've been an enormous help to me as portfolio holder. You really have. I mean, I don't want to focus too much, obviously, on the pandemic, but I've got to say this. I mean, during the pandemic, I mean, it was an absolutely awful time. And we were having sort of like meetings, and Rosa were pulling meetings, and we were having meetings in the morning, and we were having ones at night as well all the time. And there was one thing I could always say about Rupert. Rupert would always be there. And he would always be there offering that support and that reason, so like argument, and that reassurance that everybody needed. So some of the people that weren't as fluent in some of the issues around a global pandemic, such as myself, Rupert were there to basically sort of like provide that guiding hand. And I'll never forget that. I remember some emails going off late at night and early mornings about various events taking place, and Rupert being straight on them and dealing with it. And I can't stress enough how much that meant to have that solidity that we had at that time. And again, throughout that, really, I mean, because he did that in such a way, I mean, he was the epitome of certainly a really true public servant, but also the epitome of somebody who was super cool and had super cool knowledge. So we knew to contact you. It's like you can think about 007 and Daniel Craig, fair enough, and think about the Fonz, but we'd got Rupert. And Rupert were always there at the end of the phone, and he were always there giving those sort of like podcasts that he gave out on a weekly basis, sort of like telling people about this, that, and the other. But that's just half of the story. The other half of the story, obviously, is the things that you've done for Doncaster in terms of establishing some things and projects, initiatives like Well Doncaster, for instance, and some of the work that you've done, obviously, with Public Health team. So from a personal perspective, more than anything else, I just want to say it was an absolute pleasure working with you, and you helped me enormously, and thank you very much, sir.
Would any other member like to speak on this item? Councillor Glyn-Jones.
Yes, Chair. Thank you. I would like to thank Dr. Rupert Suckling for his outstanding work and support within the city of Doncaster over the many years that he's been here. But particularly, it's been mentioned, over the desperate COVID-19 pandemic period when, as Nigel said, he was here day and night offering really good, positive, solid advice. And I know that because Rupert was at the cutting edge of policy and implementation of difficult but necessary decisions to save countless lives, both in Doncaster and beyond. Rupert, you are a true servant to public life and a great, outstanding human being with great understanding, and not many people know this, but a great sense of humour and wit. So I do wish your future to have hope and meaning going forward. Thank you, Rupert.
We do have quite a few people wanting to speak, so perhaps we should hold applause till the end, or this might take a while. Councillor Rachel Blake next.
Oh, sorry, I haven't touched it right. I'll keep this short, Rupert, because I've learned from being chair of the Health and Wellbeing Board that you find you don't really like all of this. So I'll keep it short. But it's been an absolute honour and a privilege to be chair of the Health and Wellbeing Board with you as the Director of Public Health since I started. And I think people often talk about what you've done and what you've said, but for me, it's about those feelings. So as we went through COVID, we all felt reassured, safe and informed because you were there to help us. For the residents of Doncaster, you've made them feel involved, listened to, really heard and valued. And you steered us through the Fairness and Wellbeing Commission. As the chair of the Health and Wellbeing Board, you've made me feel brave, bold, ambitious and unwavering in our determination to achieve our aspirations. Thank you, Rupert. There's other reasons why I'm upset, but thank you. Thank you very much.
Thank you, Councillor Blake. Councillor John Mountsie.
Thank you, Chair. It is Dr. Rupert Suckling. I can say young man because he's a bit younger than me. I remember the days back when I was chair of scrutiny, Rupert, I used to come and talk to you regular, and you always had the advice, and all my colleagues said it. You were the man to come to. You were always there in times of need, especially my colleagues have said, it's during the COVID. But one thing I will say to you, Rupert, I have never come across an officer like you that is open, honest, is aware of people, how they think and how they feel. You make me proud to have known you, young man. You are simply one of the best. And there's only one Dr. Sutton. It's you. Thank you.
There's only one Dr. Sutton.
Councillor Sarah Smith.
I'm going to take it right back. So I'm quite lucky to have worked with Rupert before I was a councillor. And I've been following him on Twitter for like so long. And I get all of my research and everything. He always provides so much great learning. And I met him properly in person, which was, I was like proper fangirling when I got to draw, get Doncaster move-ins learning. And through that process, documenting the team's learning, I got to learn so much. And it really inspired and got me open the door to really realising what public health was about. It was about community, justice, health, and creativity, all things I like. I'm so passionate about, and I got to learn so much in that process, which made me a better healthcare professional as well. And actually, one of the reasons why I wanted to become a councillor, having had that brilliant experience working with Rupert and his team and under his leadership, and seeing just how listening to people and doing creative things and working with people authentically really can make that difference. And I wanted to be a part of that thanks to Rupert. So you can imagine my surprise when I got to be chair of health and adult social care scrutiny for a bit and got to work with him further on there, and probably annoy you a lot in our North locality meetings. So thank you so much for all your time and inspiration and awesomeness.
Councillor David Shaw.
Put me back on. That's it. We're there. Sorry about that. Yeah, I mean, I don't want to duplicate the words that have been said. I mean, they all resonate, I think, with all of us, and they do with me. So I wanted to thank you, really, and I think, you know, often, particularly in my early years as a councillor, I would be, for those who were being kind to me, I'd probably be described as over enthusiastic, shall we say. You know, and and I know you've taken calls from me every hour of the day, including Sunday mornings, and you've always taken on board what I've had to say. You've always listened intently. You've always given good advice, and you've never made me feel sort of stupid or the wrong side of it. And you know, you've also supported projects that I've been involved with. You know, you've worked really hard to find pots of money to get really important projects off the ground, and you've supported me in my attempt to do that. So it's just a heartfelt thank you, and you know, just to wish you the absolute best, and you know, as Glyn said, that there's some, you know, we have hope for you for the future. So thank you very much, Rupert.
Councillor Leanne Hemshall.
Thank you. So Rupert is the epitome of public service. Nothing is ever too much trouble. As North Localities lead, he agreed to meet me with the highways team to look at some road safety measures outside one of our primary schools. It was like turning up with a celebrity. Many of us had followed Rupert during the pandemic, and he was obviously a familiar face. A TA at the school was thrilled to be meeting two of her idols. She is yet to meet Peter Andre, but at least she got to meet Sir Dr. Rupert Suckling. And I'll treasure my time working with you, Rupert. Thank you.
Thank you, Councillor Hemshall. Councillor Mark Holbrook.
Yeah, thank you, Chair. I think everybody said everything that needs to be said, really. My sort of experience with Rupert is that, obviously as a ward councillor and as a cabinet member, he's always been at the end of the phone, very knowledgeable, an outstanding public servant, and I'll say that I've worked obviously in a private capacity in the civil service for a number of years, and I've never come across anybody who's so well liked, you know, in the role, and so appreciated in what you do. particularly during the COVID period. Again, you know, what you didn't know is not worth knowing. But I just think that, you know, I want to pass my thanks on for the great work that you've done. And also as well, it crosses across the divide in terms of the work that you've done. It's not just with public health. It's the support you've provided with me with the Armed Forces roles, and the support you've provided with the Armed Forces in the Doncaster community. And, you know, I thank you for that. So I wish you well for the future, and you're an absolute gentleman. Thank you.
Thank you, Councillor Holbrook. Councillor Majid Khan.
Thank you, Chair. I just want to add a few more words to what's already been said. Dr. Suckling, it's been an absolute pleasure working with you, and you've always been bold, brave and visionary, and the way you've approached public health and Doncaster. And a personal thank you, and a thank you from our community. In the peak of COVID, when people were worried and really scared, you gave our community a lot of reassurance in allowing the vaccination clinics to go ahead when we vaccinated multi-generational households. And it was something which it was risky taking on board, and we had queues going around the Gurdwara all the way to Trafford Way. But, you know, yeah, thank you for all your support with that and taking it on the chin and being with me on that journey. And thank you from the people of Doncaster.
Does anybody else wish to speak on this item? Then, Rupert, would you like to respond?
Yeah, thank you, and thanks everyone. Thank you for your kind words, and I will have a few thank yous at the end. It's much easier actually getting the questions than hearing the praise. Believe it or not, I've been in Doncaster 18 years, and when I first started in Doncaster, the iPhone wasn't invented. So that's how old I am, and in fact, that time probably I categorise in three phases. So the first phase was about 2005, 2006. So New Labour just won a third term under Tony Blair. Martin Winter was the mayor. But in many ways, it didn't matter what the national political situation was or the local political situation. It was the events that mattered. And I remember the Bentley floods of 2006, and that was a terrible, terrible time. But we did do some interesting stuff in those days. So we brought improving access to psychological therapies to Doncaster. So one of the first places in the country to do that. We ran clinical services out alongside the Chamber of Commerce in the old Icon Centre. People from as far away as Japan came to see that, and you know, that was an amazing thing. We did a lot of work that shaped the future of early cancer services in this country, and in fact, it's slightly ironic that it was early lung cancer that we brought to Doncaster. So people may remember Coffin Bush shelters. I did get a phone call from the council about a mannequin in the river in the Don that they thought was a dead body, but we got over that. And at that time, although I was working primarily in the NHS, we did do quite a lot of stuff, started to work with the council. So people may remember local area agreements and the New Deal for Communities. And the two councillors that I first met and got to know in the local authority were former councillor John McHale. And John was never seen out when I was about without a young Cynthia Ransom. And Cynthia, you've not changed in those 18 years. You still look as young and as vibrant as ever. The second phase then took us into sort of 2010 and the coalition government, Mayor Peter Davis. And despite what you might have thought was quite a tricky time, there were actually, when I look back, there were no major pandemics, no major climatic effects. And actually, despite what was changing, we could go on and do quite a lot of good stuff. People may remember the Lansley reviews. Whatever you think about them, the move of public health back into local government was seen as a success. And certainly at that time, I was able, with the team, to what I call start lots of small fires. So we've heard about the things that we did with Well North. We created a wider determinants fund in the council, so using the public health grant across a number of areas. We talked about Well Doncaster, but I was also encouraged to get involved with the community, and I was able to become a trustee of Club Doncaster. I was a trustee of Active Fusion and of Darts, and it was a great time despite what was going on with the politics. Doncaster's a big place, and there's lots of places in Doncaster we could go and work outside of the eye of anyone in central London, or dare I say it, central Doncaster. And that's why we started working in Deneby and Stainforth and places where we could really get on and innovate. And then the third phase, started, I suppose, 2015 when I became Director of Public Health. We'd got a Conservative government. I think, Ros, you'd been Mayor for a couple of years, sort of the Ros Jones years, as I call it. And I was really given, full range to sort of lead the team in the way that I thought I ought to. And we ended up with 3 values of learning by doing, so not just sitting and looking at the numbers, but getting off our chairs and getting out there. We made the invisible visible, so some of the things that we'd seen in, the Denebys, the Mexboroughs, even the central localities, we should be talking about, but we should do it by being relentlessly kind, and hopefully that compassionate approach you've seen come through. Whereas maybe that sort of second phase, I was trying to start things. Very much in this period, we were trying to keep things going, and it was great to see, Doncaster continue. Great to see, as Rachel mentioned in the report, the establishment of Health Determinants Research Centre, one of only a dozen in the country, but also about things that we've done with Sport England. So being a local delivery pilot for Sport England, thinking of, Debbie's probably cringing as she hears me say, but, we're one of the few authorities that is invested in leisure centres and is not actively closing them. And to think about the buzz that we got when we had the Tour de Yorkshire finishing. I know it came out along your front door, Dave, and I'm sorry for that. But it was great. It was a great time to be in Doncaster when those things are happening. But as people have said, we did experience that sort of pandemic at the end, but also, 2019 was flooding, we had a pandemic, we had wildfires, we had the hottest day on record, and it's the events really that have shaped things. And as you sort of go forward with, national election on the cards, local elections to come, I just sort of be sort of mindful for everyone that it's the events, the other things that happen that will really shape things. So I do want to just give some thanks as I close. I want to thank my team and Rachel in particular. I think the way that they've stepped up in my absence has been commendable. And I suppose I would say I expect nothing less from them. But it was great to see, and it's been a real pleasure to lead them. It's also been great being part of a fantastic directors and leadership team. And if I'd not been giving you that clear, calm advice over COVID, Councillor Ball, Damien would have given you advice, and I can only think of what might have happened there. I've been really fortunate to work in a great place with great partner organisations, and particularly a really vibrant third sector. And whatever happens in this chamber, we know that our third sector is really crucial for us. You have been the most passionate, demanding group of members that I've ever worked with. But I particularly loved scrutiny. I've loved coming into this chamber. I've been blessed to work with some great cabinets and a fantastic mayor. And thanks very much for your very kind words, Ros. I do want to thank the Doncaster people, though, because it's their grit and resilience and their way of life, really, that I've been privileged to just sort of intrude on for the last 18 years. And when I'm gone, they will still be there and they'll still be living their lives, making ends meet in Doncaster. And I do want to thank them. And finally, just want to thank my wife, who's in the audience, just for her support over this time. Thank you.
Thank you, Rupert. Mayor Jones, as the proposer, you have a right to reply. Would you like to exercise it?
I think the people in this room have already done that. It goes from the bottom of all hearts, all the work that you've done. And Rupert, we will keep true to your themes. We'll give scope where it's needed, but also call to account when we think it's also needed. Thank you, sincerely.
Thank you, Mayor Jones. The vote of thanks for Dr. Rupert Suckling has been proposed and seconded. I'd like to take this opportunity to fully endorse everything that's been said about Rupert. The City of Doncaster owes him a great debt for his years of service. Do we all agree with the motion? Yes. That is unanimous. Thank you, everyone. That takes us on to item 11, Overview and Scrutiny Update, May to December 2023. I will now invite Chair of the Overview and Scrutiny Management Committee, Councillor Jane Kidd, to present this report. Councillor Kidd.
Thank you, Chair. This report provides a summary of some of the key work carried out by OSMC and the 4 standing panels between May and December last year. I'd like to start by thanking members, the executive, officers, partners, stakeholders and the public who have all taken the time to attend meetings and engage with the overview and scrutiny process. And as usual, I want to extend my thanks to Andrew and his team for all the support that we get. We continue to focus on performance monitoring and review work through overview and scrutiny to ensure we consider how we add value to services and how effectively communities and residents are being supported. We've enhanced our critical friend role by making sure that we invite cabinet members to the quarterly performance meetings, and thank you very much to the executive for attending and taking our questions. We constantly adjust the agenda to get the most out of it by putting focus on different areas at each quarter. And we focus on the great 8 priorities of Doncaster in order to be as strategic as possible. The report highlights the engagement with key partners, stakeholders and the public, including those with lived experience, such as volunteers, food bank representatives and people who use the family hubs. This has helped scrutiny members better understand service delivery from the user's perspective. Outside of the formal meetings, the Chair and Vice Chairs meet regularly with the Mayor and Cabinet members to keep up to date with developments in portfolio areas and effectively plan and manage work plans. Overview and scrutiny members have also received some training support and guidance from the Local Government Association to aid us with our questioning skills so that we can add value to the overview and scrutiny process. And this support will continue in the new year. So I'd like to extend a quick thanks to Judith Hercombe from the LGA for the support that she's giving us. Looking forward to 2024, some of the key issues we'll be focusing on include the budget proposals and corporate plan, regular finance and performance updates, review of the crime and disorder partnerships, performance and priorities, and public health protection annual report. Once again, I'd like to thank all members, partners, stakeholders, officers, young advisors, and members of the public who continue to contribute to the overview and scrutiny process. I'd just like to invite the chairs of the panels to give a very quick upview of some of the work they've done over the past 6 months. I know Majid has had to leave, so the reason I was looking at my phone is that he's actually sent me a few points to read out on his behalf. So this is regeneration and housing. It's just saying most recently we looked at the housing retrofit programme, the progress that's been made, challenges we are facing and changes in the landscape which are impacting the programme. I also met with Deputy Mayor Jones and Dave Richmond to discuss the new regulatory framework for social housing providers and how this may impact us as a local authority and landlord. This was then picked up and looked at in detail in the Region and Housing panel in October. I'm pleased to say that as a good landlord, we already meet or exceed many of the standards met in the new framework. So thanks, Councillor Khan, for that quick update. So would some of the other chairs like to contribute a little bit? Thank you.
Thank you, Councillor Kidd. Would those chairs who wish to contribute indicate now by pressing the red button? Councillor Leanne Hempstall.
Thank you. The theme for children and young people overview and scrutiny panel this year is child poverty. Unfortunately, this impacts many. As a panel, we visited the North Family Hub in Woodlands. We got to see firsthand the great work that they do with their families. Despite the significant cuts to Doncaster's funding from central government, Fortunately, Doncaster Council, under the leadership of Mayor Rog Jones, has managed to keep providing vital local services such as the family hubs and have an effective and fantastic communities team. So I'd just like to thank everybody involved for the Children and Young People's panel, all the members, and as you've already mentioned, the Youth Council and Young Advisors. Thank you.
Thank you, Councillor Hemshall. Councillor Glynis Smith.
Right, okay. Yes, we had the Better You service come and talk to us of View and Scrutiny, who are providing a service for young adults from 18 to 25 with mental health issues. This has for a very long time been a real gap in services in Doncaster, and hopefully this is going to absolutely bridge that gap and provide somewhere for those young adults to be looked after in the right way. We did have some people with experience of the service, some young people, as well as people from PFG who came to talk to us about that service. And, you know, hopefully that's going to provide Doncaster with a service that is very much needed. And gives opportunities for healthier, happier and longer lives for all. I would say the training I have found absolutely beneficial, and as a group, some of us also attended a conference around dental services, which I'm sure we all know are in an absolute mess across the country, but in Doncaster, which was really beneficial for all of us, and that's going to be our next Overview and Scrutiny Committee in February. Thank you.
Thank you, Councillor Smith. Councillor Gemma Cobby.
Thank you, Chair. For Communities and Environment, we continue to review the extreme weather, including the newly revised flood management strategy for the next few years. We had an update on the 2023 crime and safety strategy, discussing retail crime as suggested by members from outside the committee. And recently reviewed the worker street scene in relation to fly tipping. And we have another panel back on Monday as we informally review looking further into race management and again back into the extreme weather such as the high temperatures we've had over the recent years. And again, just want to add thanks to our members in the committee, external partners who've visited, and also our team as well who work highly with us within the department as well. So thank you.
Thank you for that, Councillor Cobby. Does any other member wish to speak on this item? I'm not seeing any requests, so Councillor Kidd, would you like to exercise your right of reply?
It's just to formally present the report for everybody's information. Thank you, Chair.
Thank you, Councillor Kidd. There is a proposal that the scrutiny update be noted. Is it noted? Agreed. Item 12, proposed diary of meetings 2024 to 2026. This report has been presented to full council to allow the Mayor of Doncaster, other political group leaders and elected members to be consulted on the provisional diary of meetings for the 2024, 2025, 2026 municipal years, prior to formal adoption at the annual meeting of the council in May 2024. Does any member wish to speak on this item? If any member wishes to speak, please press their buttons now. No, not seeing anyone indicating. So, is there a proposal that we note that the final version of the diary of the meetings for 2024 to 2026? That's noted. Item 13, vote of thanks to the Reverend Canon Stevens. I would like to now propose a vote of thanks to the Reverend Canon Stevens, who is retiring from his position as Canon of Doncaster Minster. I wish on behalf of the City of Doncaster Council to pay tribute to all of his hard work throughout his years of service. Canon Stevens has been a staunch supporter, advocate and loyal friend of this council, and the City of Doncaster has played an integral part in many of our major celebrations and acts of remembrance. His presence at future civic events will be greatly missed, and we as a council would like to take the opportunity to say thank you for his years of devoted service to Doncaster. I believe David Nevitt will be seconding my proposal.
Thank you, Chair. I'm pleased to second this motion. I would also like to add my thanks to Canon Reverend David Stevens. He supported Kathleen and me during my time in office as a civic mayor, and he attended many other events in the civic life of Doncaster City during that year, before and since. His enthusiasm and empathy is at odds to his booming voice to make sure people listen at the correct time. He has been a great asset of Doncaster, and his leadership will be missed when he moves out of our area to over the border of North Yorkshire. I second the vote of thanks.
Thank you, Councillor Nevitt. Does anybody else wish to speak on this item? Mayor Jones.
Thank you, Chair. I think we should also pay tribute to the Reverend Canon Stevens on the way he's conducted many of our services which were not civic also, very much playing a big part when we have the Armed Forces Days and actually Remembrance Days, but as importantly, being a man of the community, actually bringing forward different things that assisted from getting the church to actually help people learn the English language, to actually going out there and helping people with food banks. So he's played a wider part than just the church community. He's been a valued member of the city of Doncaster. So our thanks should go for all the work he's done, both spiritual and also community.
Thank you, Mayor Jones. Councillor Ian Pearson.
I'd also like to reiterate my thanks and my wife's thanks for his help while I was civic mayor. But as Ros has just said, it's not just civic events that David, and as a man with a similar booming voice, has managed to put his voice to in many events, giving ideas, encouragement, and offers of interreligious talks and events. I think it will be a very difficult job to fill. I'm told that I thought it would only take a short time, but I'm told it could take possibly 12 months before we have a replacement. And I think we will notice that gap because it's going to be a very, very hard act to follow. And the Minster and the way he's put it out there and promoted Doncaster has been spectacular in his period here. So again, I would like to say thank you to David for all the work he's done. Thank you, Chair.
Thank you, Councillor Pearson. Does anybody else wish to speak on this item? In that case, the formal vote of thanks to the Reverend Canon Stevens for his service to the council and the wider city has been proposed and seconded. Is it agreed? That is agreed. Thank you. Item 14, questions by elected members. There are no questions on notice, so we'll move to next item, questions without notice. Please use the button on your console to indicate if you wish to ask a question. Are there any questions to Mayor Ros Jones? Councillor Bluff.
Thanks very much, Chair. Ros, since 2019, we've unfortunately had several flood warnings in Lower Sprotborough. Last year, I had to don my wellies and go down to the river once again. And unfortunately, we had residents being displaced once again. And also the pub is now closed again after it recently reopened. So some of those failings for there were down to the EA pumps failing and some of the valves along the river. But I'd like to thank Dan Swain and his team for the effort they did in responding extremely quickly. Over the last few months, I'd like to thank Councillor Cole for coming down to the river. We've also highlighted that the river itself didn't breach the flood wall that's been built there. In fact, the water just came round it and went a different way, came down the slipway there. And I think Councillor Cole's come up with a suggestion of how we could resolve that. And I know There is a report being produced by the engineers, and I hope we'll get sight of that soon. However, the residents there are aware that there was a government scheme set up in 2017 for flood recovery. And I think there's various mechanisms in there within that framework for them to get funding for items for the house to try and protect against flooding, and also for them to try and recover. I understand there is some requirement on how the local authority claims that money back from central government in terms of being able to give that money out. But it's a bit unclear whether or not we can give that money out to residents and basically have to stand it ourselves. The framework's a bit unclear. I wonder if you could perhaps investigate how that framework works and maybe try and help some of the residents out.
Mayor Jones.
I am aware how that scheme works. However, you'll want a detailed report on that, so I'll get that in detail in writing to yourself. Thank you.
Do you have a supplementary question, Councillor Bluff? No. Councillor Jane Cox.
In April 2023, a resident of Finningley sadly passed away. His work colleagues had purchased a defibrillator in his memory and given it to his family to place at the top end of the village. Across the world, we have defibrillators in various places, but none that cover this area. There starts the problem. There is an old adage that where there is a will, there is a way. Unfortunately, we have the way, but the will is sadly lacking from council. Since May 23, we've been trying to find a solution to this problem, but every turn we are thwarted by council bureaucracy. We are now nearly a year in, and I can't imagine how this family are feeling. We have suggested many solutions to this problem, but none will be agreed upon. We're now at the stage where council have decided they need a policy. We all know how long that's going to take. We've put Christmas decorations on lampposts, but will not allow life-saving defibrillators. I understand there are others across the borough in similar situations. Will the Mayor commit to looking at this situation and solving it immediately before another life is unnecessarily lost?
Mayor Jones.
If you put your request properly in writing, I will pass it to the relevant portfolio holder who actually knows far more details about what the lampposts can and cannot stand and the work that's been done to replace them. Thank you.
Sorry, I've got it. Do you have a supplementary question, Councillor Cox? Councillor Nick Allen.
Thank you. The LTA recently announced a partnership funding agreement with the council to improve tennis court surfaces in Haslam Park in Bessaker and another park in Hexthorpe. I was just wondering if this funding proposal and the money coming in would affect park spend budgets elsewhere, particularly in Bessaker Ward, where we need spending on, amongst other things, Bolton Hill and Cantley Park. I'm hoping, that I've been told about different projects that are going to be happening, but there's the possibility that effectively the council might turn around and say, well, we're not going to spend on that anymore because you've got so much money because of the LTA's funding agreement with the council. And I don't think that necessarily seems right. I think we should still spend on those Bessaker parks as well.
Mayor Jones.
Again, if you did want a full answer, I would recommend that you put this in writing so I can get you the full details of what's coming in and what we're actually expending money. So please put it in writing and we will get the appropriate answer.
Councillor Allen, do you have a supplementary question? Any further questions for Mayor Ros Jones? No. Do we have any questions for Deputy Mayor Councillor Glyn Jones? Councillor Nick Allen.
Are you allowed to reveal how many residents locally are subject to a SPOC by the council?
I am quite intrigued as I keep on being asked about SPOCs. I can't see where this actually falls into the housing and business element of my portfolio. I haven't been involved in the SPOC process for the best part of 3 years, so I can't help you, Councillor Allen. Sorry.
I assume there's not a supplementary question then if we're not finding the right person to... I'll bring in Scott.
The council does hold a list of the number of people who are subject to various SPOC, which for those who aren't aware is single point of contact procedures, and I can get that for you outside of this meeting, Councillor Allen.
Thank you for that, Scott. Do we have any further questions for Deputy Mayor Councillor Glyn Jones? The microphone was on. The answer in summary was that Scott will be able to provide a full list of individuals under his SPOC outside of the meeting. Do we have any questions for Councillor Lady May Ball? Oh, is Lady May Ball here? No. Please put them in writing if you do. Do we have any questions for Nigel Ball? No. Do we have any questions for Councillor Joe Blackham? Councillor Cynthia Ransom.
Thank you, Chair. Thank you, Councillor Blackham, for the update on the Mar and Hittleton bypass. Could you possibly put it in writing to me, please, because I will need to inform the Mar and Hittleton residents.
Councillor Blackham.
I can certainly make arrangements for you to receive it in writing, Cynthia.
Any supplementary question? Any further questions for Councillor Joe Blackham? Do we have any questions for Councillor Rachel Blake? Councillor Tracy Moran.
Hi Rachel, I just wanted to ask a quick question. Just were wondering, why do we have the Choose Kindness initiative here in Doncaster?
Thanks very much, Tracy. I'm very happy to answer that, and also happy to talk about the progress that we've been made. I think to answer that probably sums up what's happened in this chamber today. So I think we've talked about making the visible invisible. That's what Choose Kindness is about. We've talked about that unwavering compassion, which is what we want in Doncaster. And we've also celebrated people, Rupert, you know, the Reverend, the Canon in this case, but also it's about celebrating all those wonderful people in our community that day in and day out, who you all know, do amazing things. But it's also, the other bit of Choose Kindness is about what we heard earlier, which I can only really describe as a rant, which I actually found deeply offensive. So it's also about standing up when people make comments that other people will find offensive. I found that comment offensive on a number of levels. One, I can't imagine what it must be like to not be sure about your gender and then hear it politicised, that it's a political issue, when really it's an incredibly personal issue. I think it was also very offensive to say that that's what our schools are talking about. Most of the people who work in education that I know are struggling to give our children an education, sharing one book between 30 children, trying to find a building that doesn't let water in because of the lack of investment since 2010. And the other reason why it's offensive is because we as a community don't want to have those types of discussions. And I think there's a belief, isn't there, that when we talk about one community, nobody else is particularly affected. It's always seen as something that, you know, only affects that one community. And that's how Choose Kindness came about. It isn't my idea. As a cabinet member, I follow the same approach that I do as a councillor, which is I go with what people want us to do as a cabinet. You know, I didn't sit there and dream up Choose Kindness. It's about 50 odd people that come to a meeting at one point nearly every month to talk about how we can challenge some of the attitudes that currently exist in our communities and to celebrate what's good about all of our communities. Because I think if you don't challenge, and we had a really good discussion at our last Choose Kindness movement, was we heard about somebody that had expressed incredibly homophobic and transphobic views about how it made that person feel and how we as a group want to respond to that, which we did and we are doing. Because I think if not, people assume, particularly on social media, that those views are the ones that everybody shares. And if that's you, if that's somebody that affects you, or because you're just a right-minded, decent person, then you think that you're on your own. So the Choose Kindness movement is about challenging what I would call those outdated, whatever people want to call them, culture wars, dog whistle politics, you know, I don't know what the words are, but it's what people find offensive. And in Doncaster, people don't want to hear that, because day in and day out, they are about being an inclusive, kind and compassionate community. And that's what I think everybody in this chamber wants Doncaster to be. We've got a fantastic opportunity now that we're going to take Choose Kindness out. All those local people that have been involved don't just want it to be one big meeting. So I would really hope that all the councillors in this room want to be involved in your Choose Kindness club, or hub, as we're calling it in your locality. It's a real opportunity to work with your communities. It's to make those people that are invisible visible, but it's also about a celebration, because Doncaster is a wonderful place, and that's what Choose Kindness about. So please do join. Please do feel free as well when, you know, as a group, our movement is about challenging things that we find upsetting or offensive. And really allowing people to concentrate on the issues that matter to them. Because really, you know, what the Choose Kindness movement sums up is that we have far more in common than we don't. And if people don't feel like that, as my learned colleague at the back once said to me, if you Choose Kindness isn't your view, then Doncaster's not the place for you, and on your bike. Thank you.
Thank you, Councillor Blake. Councillor James Cox, you have a question.
Yeah, just on the back of what you've said, I think I've sat in this chamber now for quite some years, and sitting over this side of the chamber, I've been called scum, I've been called a murderer, I've been called nasty, because I hold a different opinion to some other people. So if we're talking about Choose Kindness, then I think it's a little bit hypocritical from that side to be criticising this side when I sit here and get insulted on probably an annual basis. It's just really tricky, and I'm not a nasty person, and I wouldn't dream of calling somebody a horrible name across the chamber.
And you know, if in terms of being called scum or anything like that, any right-minded person would think that's deeply offensive. So, and I don't think it is hypocritical for me as the Equalities Lead to champion Choose Kindness, because it's about what our communities want. And I think why Choose Kindness is important is I will give you that guarantee. If I see that behaviour in here from any side, I'm more than happy to call it out, which I have just done. So that's what Choose Kindness is about. If it, as I say, that's historic. If I see it as the Equalities Lead, whatever colour of political party, I won't certainly be tolerating it in this chamber, and I'm sure nobody else will as well.
It wasn't technically a question you asked, but do you have a supplementary? There is a question.
I'd just like to say it's minuted, and it's on YouTube, so feel free to go and watch it.
Again, not really a question, so
Sorry, statement.
I won't expect a response to it.
You know, we all can't talk about what may have happened in the past, but I think if we're all committed to Choose Kindness in the chamber, then going forward, that wouldn't happen. And then hopefully, Jane, your experience in the chamber wouldn't be that.
Thank you. What about people who might well feel excluded from the Be Kindness initiative? For example, members of the public who are subject to SPOCs because they're not allowed to communicate effectively with, amongst others, the Deputy Mayor or members of the Cabinet, and yet nevertheless have very real, sensible concerns about racism in Doncaster and want to raise them. I don't think they could embrace the Be Kind initiative. Truly, they might see it, unfortunately, as quite hypocritical, particularly, and I think we all know whose correspondence I'm talking about, you know, you just won't meet that particular individual to discuss his concerns. So he must therefore feel very excluded.
Councillor Cole, I can't accept interventions from members in response to questions unless I can take a point of order, Councillor Cole.
Chair, I'm just worried that it's not appropriate if any of the questions in here may identify an individual member of the public and compromise their privacy. I don't think that that's within our rights, and so the legal officer might guide us on that. I'm just concerned. I know that if someone made an oblique reference to, I don't know, one of my parents, then that would not be appropriate. So
I'm happy to answer it.
I'm going to bring in Scott first to give us a legal point of view on the point of order that was raised. Scott.
I don't think the question went any way towards identifying the individual, and I suspect that neither will the answer. I take your point, Councillor Cole, but I think that both parties are fully aware of how to deal with this matter without breaching anyone's particular individual rights.
Thank you, Scott. And Rachel, if you'd like to answer.
Thank you very much. And anti-racism is something that I have probably championed since I was about 10. And we'll continue to champion it. But it's not just me as the Equalities Lead that does that. In terms of what we're doing in terms of anti-racism, I was delighted that a week ago, 55 colleagues from Team Doncaster attended the Black Leaders anti-racism training. All those people attended that training from across Team Doncaster and including the voluntary sector. And we will be producing a 10-point plan for Doncaster. The Mayor and others of Cabinet were at the training as well. And so we are taking anti-racism incredibly seriously. What we're also doing is using the Local Government Association framework, and we are examining where we are as a council in terms of equalities and benchmarking ourselves about where we are now and where we want to be in the future. We have the Fairness and Inclusion Forum that is going to be revamped. And we're also doing what some people might call smaller things, working with a range of different voluntary groups who represent the Black community. So, for instance, we have put in a bid to have a huge Windrush celebration in Doncaster, working with those voluntary groups. So I can assure you that anti-racism is incredibly high on my agenda as Equalities Lead. I am working with Black citizens, as I will continue to do so. And I think, again, it's something that we as a council and Team Doncaster are going to be championing.
Thank you, Councillor Blake. Do you have a supplementary question, Councillor Allen?
No, I don't, no.
Okay. Do we have any further questions for Cabinet Member Councillor Rachel Blake? No. Do we have any questions for Cabinet Member Phil Cole? Councillor Ransom.
Yes, please, Chair. Councillor Cole, it's twofold, this question. Part is yours, and I think part goes under communications as well. The problem I've got is a lady and gentleman in Sprotborough who were flooded through no fault of their own is actually being charged double rates. They've tried to apply for relief for this. This is the second question. So the question to you is, what relief is given to people by Doncaster Council when they are flooded and they've got to live in temporary accommodation? In other words, they're paying two lots of council rates. The second question was that she tried to sort this out with Doncaster Council, which turned out to be a very poor experience with communications, in as much as the telephone system, they kept telling her to go onto the internet, which she did. They guided her through it, and it was virtually on a loop that kept going round and round and round. The lady in question was on the phone for 2 hours and with no answer whatsoever. This, with the communications, is something that's cropped up quite a bit in my ward, with problems getting through, in as much as press this, press that, submit it, and then it doesn't work. So I'm willing to discuss it outside this meeting, but I do want both highlighted, please.
Councillor Cole.
Thank you, Councillor Ransom. I'm sure your constituent will appreciate you raising it, and we'll make sure that the appropriate Cabinet member provides a full written reply to you. Obviously, if there are further details or circumstances you need to impart by email so that we can give a fuller answer, then please do so.
Do you have a supplementary question, Councillor Ransom? No. Thank you. Does anybody else have questions for Councillor Phil Cole? If nobody objects, for just ease of, I'll allow Jane to come in on that.
Yes, Councillor Ransom, Cynthia. We'll have a chat outside the meeting, one about that, but also about council tax relief for a property that's been flooded, because I am aware of what's happened in the past, etc. So we'll have a chat and then I'll take it up.
Thank you, Jane. If there's no further questions for Councillor Cole, then we are on to Councillor Holbrook. Do we have any questions for him? No. Do we have any more questions for Councillor Jane Nightingale? No. Do we have any questions for Councillor Sarah Smith? No. Elected members can now put questions to the chairs of committees. Are there any questions for the chair of the Audit Committee, Councillor Austin White? No. Do we have any questions for the chair of Elections and Democratic Structures Committee, Councillor Julie Grace? No. To the chair of Health and Wellbeing Board, Councillor Rachel Blake? No. To the chair of OSMC, Councillor Jane Kidd? No. That brings us then to agenda item 15, approval of councillor absence. The purpose of this report is to note the action taken by the monitoring officer, Scott Focus, acting under delegated authority and in accordance with section 85 of the Local Government Act 1972, and approving the request from councillor Andy Pickering for an extension of absence from attendance at meetings due to ill health until the 31st of May 2024. Does any member wish to speak on this item? No, then can I ask members to move the report be noted? It is noted. Agenda item 16, minutes of joint authorities. These are for information and not endorsement. Does any member wish to speak on them? No, then can I ask that members move that the minutes be noted? They are noted. Members, ladies and gentlemen, that concludes the business of today's meeting. I now declare the meeting closed. Thank you.